It's Bedhead Cast Season 3. I'm Dr. Chris Gorman, and it's all about sleep, sanity, and success. And today's episode is my doctor has referred me to a sleep lab to have a study, and then what happens? And I want to introduce Nicholas, sleep lab director, I should say, and he's a well-traveled person. He's originally from BC, then he met a girl, got married, moved to South Africa, that's where she was from, came back, and thank goodness Nicholas joined our team. He's been such an asset as the director of our sleep lab. Welcome, Nicholas.
Thank you very much, Dr. Gorman. I'm very happy to be a part of the cast here. And yes, that's true. I was in South Africa, and I've had my fair share of experience of getting used to the time changes and changing when you go to sleep and having to get up at these different times. So I'm excited to be here and share my experience with you.
Well, that's what we're looking for. Somebody who's had experience with whatever sleep issue has occurred, and then which makes them a better person who's seeing people with sleep problems. But one of our traditions is word of the day, and today it is REM.
REM.
Right.
Oh, right.
That's right. And it was a name of a very famous band called REM, and it was based on stages of dream sleep, which is what REM is. So getting back to the original question, my doctors referred me for a sleep lab study, and now what am I supposed to do?
That's right, Dr. Gorman. Lots of people get referred for sleep studies each year, and there's a traditional way that would happen, and that's where the doctor will refer you, and then you're going to come into the clinic and you're going to get put with all these wires and sensors, and you're going to go and you're going to sleep in the bed in the sleep lab, monitored all night. Now there's different variations of sleep tests, and that is the gold standard for sleep tests, and that is called the level 1 sleep study.
I see.
But there's a total of 3 different sleep studies. There's the level 1, 2, 3, and sometimes a 4th sleep study too.
Okay.
But we want to focus on what really a level 1 sleep study entails, and kind of what will happen, and walk you through the procedure. So you've been referred by your doctor, you've come to the front door, you've arrived for your appointment, and now what's going to happen is a technologist will open the door for you, show you to your private room. It will be only you there. And then the technologist will let you get changed into your pajamas, get settled, and then after a couple of minutes, they're going to put all the wires and sensors on you. And this is really fascinating because these wires and sensors, they're measuring the electrical change of your brainwave. And what sleep technologists do is they'll categorize the different patterns of electrical change in the brain, and then they'll distinguish what stage of sleep that is. So level 1 sleep study is the only sleep study where you can get the brain reading. So the other sleep studies, they're more targeted towards specific sleep disorders.
Okay. 1
or 2 sleep disorders, whereas the level 1, it's a broad assessment of sleep. So you're getting there's over 80 different sleep disorders, and this sleep study is going to really be able to pick up and help identify what's going on in the night. And the level 1 sleep study it's a comprehensive test, and by being able to see the different brain change, the brain activity changes, we can really see what potentially is causing a disturbance in bed. And this is why a level 1 sleep study is so important, because a level 2 sleep study, if you're at home, you're sleeping at home, because the level 2 and the level 3 are done at home.
Yeah.
But then you have a dog who's sitting, your little pet dog, and his tail is whacking your leg all night.
Right.
Now for us, we're going to say, oh, you have crazy movement all night long.
Right.
It's crazy
right.
movement.
Restless leg.
There we go. But it's actually restless dog legs.
Yes, I see. Okay, yes.
So in the level 1 sleep study, it's the preferred one because it's a controlled environment.
Right.
So we have the appropriate blinds, there's no windows,
Yes.
right temperature, there's no distractions or no one else, no bed partners waking
Yep,
you up.
yeah, oh, for sure.
And this is important because during your sleep study, we're trying to identify the depth of your sleep.
Yeah.
And also, when you're sleeping, you go through a set amount of stages. So you should go through stage 1 sleep,
Okay.
which is just a transitional sleep,
Okay.
into your stage 2,
Okay.
and then it will go to your deep sleep stage 3 as the night progresses, and then you'll get little bits of REM sleep
Okay.
in between there.
All
And
right.
this is really important because if any time throughout that section you're being woken up, or
Right.
there's something waking you up, it's disrupting that cycle. And it's important to identify what's disrupting that cycle because
So is that sometimes referred to as sleep architecture?
Exactly. Yes,
Yes.
exactly. And what will happen is your sleep architecture can change
Okay.
depending on, you hear obstructive sleep apnea a lot.
Okay.
It's common. It's a very common thing you hear. But the fundamental problem there is that your sleep is being disturbed over and over and over, preventing you from getting into that slow wave sleep for extended periods of time.
Right. And the outcome of that, like what happens after a night of sleep like that?
Well, that's just it. So lots of times patients will come to us and they're going to tell us, no, we can't sleep in the lab. There's no way we're going to sleep in the lab.
Right.
Well, could be a few things going on there, and it could be that their sleep as is right now isn't really structured and good sleep, so they're nervous. They
Yes,
have a little
absolutely.
bit.
Sleep lab anxiety.
That's right, sleep lab anxiety, and it's a
Right.
scary thing. You're
Yeah.
coming to a new place, you're going to sleep, but we do offer a sedative. So there's
Right. Okay.
So there's a light sedative medication. It does not alter the results at all.
Right. Okay.
It really just helps you, put you at ease, and it's going to help you fall asleep. Because remember, there's a bunch of wires and sensors,
Yeah. No, for sure.
and it can be a little bit funny to sleep with. But after about the first 5-10 minutes,
Right.
majority of our patients just say they didn't even realize they forgot about this.
Yeah. No. Exactly. Well, it's always the anticipation is going to create the anxiety, and to know in advance if you're having any trouble sleeping, we have a medication that can help, which is not going to interfere with the test, but also I'm assuming the manner of the technologists, yourself, you're generating trust
That's
that
right.
it is the right thing to do.
That's right. And the important part about the sleep study as well is it doesn't only have to be referred by a physician. Lots of people think that they need to see a sleep doctor or another doctor.
Sure.
But from my perspective, the level 1 sleep study is the ultimate sleep assessment.
Right.
So it's going to give you evidence, a factual based paper that says this
Right.
is what's happening with your sleep through the night, and we can show you on paper. And from there, then we can really do a targeted treatment approach to help
Right.
you get back into sleep.
Right.
So it's really interesting to see the different types of tests that we can do, level 1, 2, 3, and really looking, but the level 2 and the 3, we should emphasize that those are really only for looking for specific things in
Right.
the sleep.
Which may in fact require the doctor to say, we don't need to do the level 1. Let's just, because my diagnosis assumption is it is obstructive sleep apnea, it is restless legs syndrome. Apart from the dog, if we can get the dog out of the bed,
Get the dog out of the room.
that's where it's necessary. But what I'm hearing is, if a patient doesn't know and they are willing to participate in having this level 1 sleep study, at the end of the day, it's going to give more information.
And it will help their doctors as well.
Exactly.
It's rare that a person, because with a sleep study, we're recording multiple parameters.
Right.
So we record a little bit of the heart, a little bit of the brainwaves, a little bit of muscle activity,
Right.
your respiratory. So when we're recording multiple parameters, it's rare for a person to be hooked up to multiple parameters being measured for an extended length of time.
Right.
So, for example, if you came in and we measure you all night, we might pick up other underlying causes
Right.
that you might not even be aware of that could be impacting your sleep. So at the end of the day, it's one of the most thorough, comprehensive tests
Right.
for an extended time.
For sure.
And all you have to do is sleep.
And you know, I what I'm hearing you say is that it's increasing access to care.
That's right.
By having, you don't need a doctor. You see a sleep lab specialist, and they're then collaborating with, you know, what they think, what the expert knows from the sleep lab, and then provide that information which the patient needs more than anybody else to then take to their doctor and get advice regarding treatment.
That's right. And just to be clear, anyone who comes for a level 1 sleep study, they get a follow-up with a doctor to thoroughly review the results with them.
Oh, that's perfect.
And
So
they'll
it's
look at it.
so it's faster access,
Yes.
but it's guaranteed access once you have the sleep study.
That's right. Once you've completed it and you've gone through the little bit of scary hoops to get
Yes.
in the lab, then it's just a matter of meeting with the doctor and going through the results.
So going to get a sleep lab study is, as you described, strange enough, having these wires attached to people and wondering if they're going to sleep or not, their anxiety. But it's also, you know, people feel vulnerable. You know, they sleeping is a vulnerable thing, just like, you know, people that sleep in a different place, they're trying to accommodate to the new environment where they, you know, will get a good night's sleep. How do you deal with that?
So we provide exceptional space here, extremely comfortable, one room per one patient. And it's just you and your technologist. You won't see any other patients here. It'll just be yourself and the technologist. And our technologists here are all certified and they're all respectful, and they will do the calibrations, the meet and greet with you.
Yes.
They will ensure that you have a tour of the sleep lab.
Right.
And they really want to make you feel safe while you're here, because it's important that you feel as best as you can when you go to sleep here to represent a true sleep at home.
Yes.
And sometimes patients may feel that their sleep here wasn't the same as it was at home.
Right.
But the best part about our equipment is it's state of the art, and we're able to see the brain during sleep.
Right.
And that's the important part, because we're able to see the depth of sleep and also if there's any other evidence of sleep disorders there.
Right. A little bit like if somebody asked me, how did I sleep last night? I'd know if it was bad, but I wouldn't know if it was good. And so I don't have a problem with insomnia or sleep, but if I wondered, then this is a way of ensuring this is what your sleep looks like while you're asleep.
That's right, 100%. And you know, we understand this. We understand that it's scary for people to come in, and we're working with one of our suppliers now, and with the latest technology coming out, there's been such advancements in the sleep technology that we may in the future be able to provide an option for those patients who really just can't come in.
Okay.
The level 2 study is getting so good now
Okay.
that some patients, of course, we prefer you in the lab.
Yes.
But at all costs, if you can't do that, we can send equipment home with
Yes.
you, and it's almost the equivalent of that level 1 sleep study.
Right.
So with future equipment and future advancements,
Yeah.
we hope that pretty soon we'll be able to get the care to the patients that they need
Yes.
in the same format as the level 2 and 3, but we'll be able to get the evidence of a level 1 study.
Exactly. And again, like you were saying, it's a controlled environment, so there'd be this new technology at the same time, I guess, as encouraging the patient to, we've got to make sure that your environment is exactly as it should be. So, Nicholas, are there things that people can bring to the sleep lab that will aid their ability to be calm enough to ensure a good night's sleep?
That's a great question. Yes, patients, we want them to have the similar sleep that they can have at home here in our lab.
Right.
So if you sleep with your pillows and it's a body pillow, bring it. If you have eye masks or you sleep with earplugs, bring everything that you would sleep with at home. And we just have some wires that needs to go on, but we don't want to interfere as much with your natural sleep.
Yeah.
We're just trying to monitor and pick up the natural sleep. But if you have earplugs, and remember, there's washrooms here, so if you need to get up in the night or anything like that, you just click the call bell. The technologists will come into the door and they'll let you in. And remember, Dr. Gorman, we have had 80, 90-year-olds in the sleep lab regularly. I think the washroom break record is a 13 or 14 in one night.
There you go.
Don't worry about if you have to go to the washroom, if you have to get up and move around. Sometimes we have patients who they just need a break from sleeping, and then they'll just read their book. There's a night light there, so you can have your reading light, and it's not like you're in a lab and you're in a system. We just have to put wires on, and from there you're on your own. It's up to you, and then it's up to you when you want to shut the lights off as well.
So what you're saying is you have these accommodations to make it easier so the study is better.
That's right. As long as you don't bring your phone. Phone.
No phones. Absolutely. Or the dog.
Yeah. Well, if it's a guide dog and it has a dog bed, then okay.
Yes, exactly. Yes. Yeah, it's such an important, the most important thing that I think over the years, if you don't sleep well, you need help. People are not going to come in after a few days of not sleeping because they can identify the stress or whatever. But even after one night of disturbed sleep, I think most people are thinking their primary thing is, I didn't sleep last night, I'm tired, and I'm going to sleep better tonight. Whereas patients who have insomnia, they're not able to say that. They've tried everything they could do, and so that's when you reach out for the assistance that you provide.
So a big portion of the sleep study and the sleep lab is patients who feel that they can't sleep and they just will avoid the sleep lab at all costs. But the trick is, if we can just see a little bit of sleep in the sleep lab. You're mentioning sometimes a patient who they don't sleep for a couple days and whatnot, but it's so important to just get a little bit of sleep for recovery. So it will really help them with their recovery.
Yeah, and my experience is that every patient that I've seen in my career, the problem always first starts or ends up with a sleep disturbance. And as I've said to so many patients, if we can get your sleep better, that's the beginning of the healing, which is So it's such an important thing. As an example, if I can't sleep one night, and I think this is true for other people, they're going to say, their first thought's going to be, I didn't sleep well last night. I'm tired. I'm trying to cope with today, and I'm hopefully going to get a good night's sleep tonight. But if not, that's when you and I end up seeing people.
Well, that's right. And at the Center for Sleep and Human Performance, we try and encourage people to focus on recovery.
Right.
People are always trying to do everything that they can do better at the gym when they're training professional athletes. But how many people do you ask, how good was your recovery today? No one practices the recovery.
Okay.
And the trick is, if we can try and help patients with transitioning into sleep opposed to falling asleep, you're going to really help the body and get a proper assessment.
Just sort of resetting the expectations and helping with, like you say, not unrealistic expectations that can stand in the way of their recovery. And the assumption, of when you say our assumption is recovery, that's such an important part of healthcare, which is hope. You've come for help, we provide hope, and it's based on people recover.
That's right. That's right. And that's one thing that I would like to say is, that's one aspect of it. And another aspect is treatment. So when we're talking about obstructive sleep apnea, and it's a common occurrence, we're not talking about, we call it treatment because it's not easy. It's not a simple solution.
Yeah.
The first solution is you have to, if you do have one of the sleep disorders, which is sleep apnea, you're going to have a closure of the airway, and then we will have to put a positive air pressure on to maintain that open. Now, it's the most effective treatment, and it really, you can see REM rebound and slow wave sleep rebound when a patient applies this treatment.
Right.
But you should just put emphasis on it that it is treatment. You need to work on getting used to that CPAP mask and ensure that your interface is all hooked up accordingly, and work with your specialist to make sure that you have the right treatment.
Well, I agree. I've always, when I saw patients previously and they've got obstructive sleep apnea, I would just think, I hope that they're able to tolerate the CPAP machine, and knowing that the emphasis is on helping the person accommodate to the CPAP machine, understanding it is difficult initially, it gets easier, but anything we can do to alter the CPAP machine or dental devices or whatever it is, that's going to be available. So Nicholas, you mentioned the new technology that's going to make home testing better some point in the future. What other advancements do you think, or do you see a role for AI helping a sleep lab and patients?
Well, that's a fantastic question. Actually, the technology is evolving at a rapid pace, and the sleep scene is really getting their taste of AI now. And what we're seeing is companies from all over, but they're picking, so we measure a lot of parameters, but these companies will pick one device.
Okay.
And then they'll use AI to get your heartbeat off of the device, and then they will measure that heartbeat through a whole bunch of different really complex ways, but they're able to really tell you your breathing pattern, your heart rate, your SpO2 values, a whole bunch of parameters just from one sensor. So that's one company. But then another company, they do the similar things with a different sensor.
Right.
So when we combine all these really advanced sensors, we're getting this really thorough sleep study. It's the aftermath of the sleep study,
Right.
because all these little AIs are going to work on all that data that we have.
Right.
And it's really being able to tell you like some really exciting news is if your SpO2, so the oxygen in your blood drops
Okay.
down a little bit,
Yep.
but if it stays down for a longer period than normal, then that can indicate some other things.
Okay.
So we're learning about, and now if we put that system, because we have all the data, if we put that into the AI model,
Right.
we're really going to be able to start to forecast a lot more through just the data
Right.
that we already have with
Yeah.
the sleep studies.
So the AI is, I think, if I could summarize, the AI is improving the technology, which is exactly what you were referring to.
Improving the technology, and I would say improving the results.
Oh, okay. All right.
Because we're able to get more information from these AI complex mathematical models through the data of the whole night study, and we're able to combine them together to get some real interesting facts of what's going on. So I think there's a big future in that.
That's great. So Nicholas, tell me at the end of this podcast today, what's your tip or what's your message for people that are listening to the podcast?
Sure. So my tip comes back to the word of the day, REM.
Okay.
When I first got into sleep, my instructor, he told me rapid eye movement, went through it, told me all about it, and I learned about the rapid eye movement. And my question at the end of the seminar was, I asked him, does he ever practice rapid eye movement before he goes to sleep? And he said, never, I've never tried something like that. So
Wow.
my tip would be, so for people who don't know, rapid eye movement,
Yeah.
REM, is a stage of sleep where your eyes are moving back
Yeah.
and forth. So my one tip would be, when you're going to sleep, just try and focus on yourself and your breath. Try and focus on that and your eyes maybe moving a little bit. Just try and get into the rhythm of falling asleep, opposed to thinking of just other thoughts and then drifting off to sleep.
Right.
Try and consciously be present with sleep as you drift away, and you should be able to find that you're more in tune with it.
Yeah, I mean, that makes so much sense. I've never heard anybody saying, move those eyes, but, we use those treatments like in eye movement desensitization, and it's helping people live in the present so they're not living in the future, which causes anxiety. My tip of the day is similar to Nicholas's. It's REM and their song, It's the End of the World as I Know It. And that's not just getting REM sleep, as Nicholas explained, it's getting into the deeper stages of sleep and the value of getting a sleep lab study if necessary. In closing, we are looking for sponsorship. It's very straightforward. All you do is email bedheadcast@gmail.com so that you can be part of people getting enough sleep, being sane and successful. So get your head to bed. Thank you. Thanks, Nicholas.
Thank you. Thank you, everyone.